Hello, and welcome to today's lecture. We're going to be discussing the history of nursing. Nursing history provides us with a framework for understanding how nursing is practiced today and looking at the trends that are occurring in society that's really shaping our profession. The characteristics of nursing as a profession and what nurses do today have the roots in the past. Today, healthcare, is highly complex. We have diagnostic methods, therapies, and healthcare has really developed to offer many opportunities for prevention, treatment, and cures that did not exist even a few years ago. So understanding this development is part of this discussion today. It helps us to appreciate where nursing is today and also may provide stimulus for change in the future. So today's lecture, we're going to examine the story of nursing and explore how it developed as a profession. Back in time, before the Christian era, many of the learned behaviors for caring for the sick was from watching animals. Examples from your text that humans learned was applying an antiseptic, applying pressure to control bleeding, amputating extremities, ingesting salt, wrapping wounds in spiral fashion, applying splints, and traveling great distance to soak in healing water. Early cultures also believed that a person's soul existed independent of their body. So if somebody became ill or if they had tragedy, it was blamed on the spirit world. Early history of nursing focused on the ancient Egyptians, the Greeks, and the Romans, which we're going to discuss in the next few slides. During this time, communities often had women as assisted with childbearing and as a form of nursing care. The Egyptians had physicians, and a sick person would usually go to a physician looking for magical answers. They derived their therapies from plants, animals, and minerals. In India, the qualification of a nurse was they needed to have knowledge of drug preparation, they needed to be clever, they needed to have a devotion to their patients, and they needed to be pure of body and of mind. Greek mythology recognized health issues in physicians and its gods. Hippocrates, a Greek physician, is also known as the father of medicine. He contributed to healthcare by writing a medical textbook that was used for centuries, and he developed an approach to disease that would later be referred to as epidemiology. And he also wrote the Hippocratic Oath. The Greeks viewed health as a balance between body and mind, and this is a different perspective from earlier views of health that really focused on curses and sin. If we look at the 1 to 500 Christian era, the focus with the Greeks was skin care, cleanliness, mouth care, pain control, and also they used music for soothing and relaxation. And this was where the first maternity hospital and the home for dying we see. During this time period, there were many Romans that converted to Christianity, and they opened their homes to the sick and the poor. Many of these women were from well-established Roman families, and they were dignified, and they had respected and high positions in their society. These Roman matrons organized and delivered care to persons that were in need. Early church deacons and deaconesses sought out those in need, and they established a system of visiting the sick in their home or visiting nurses, and sometimes they even brought the ill into their own homes. The bishops built shelters, hospices, asylums, nursing hospitals within the monasteries, and nursing religion orders were formed and flourished during this period. In the Middle Ages, we see a rise in Christianity, and this led to a more structured nursing care, but it was still far from professional nursing. The Crusades and Nursing Knights. Under this came the Order of St. John. They consisted of men devoted to charitable work. They formed cottage hospitals, convalescent homes, nurses training, and they even had a separate hospital for lepers. Men were also involved in nursing at this time. For example, men in the Crusades cared for the sick and the injured. And these men wore large red crosses on their uniforms that distinguished them from the fighting soldiers. So this became known, this is where we got the Red Cross from. The religious orders, nursing for women, because women continued to carry most of the burden for caring for the poor and the sick. We had discussed in the previous slide, deaconess, who provided care in their homes to the ill and the sick. Women who served in these roles had to follow strict rules set by the church. This role eventually led into or evolved into that of nuns, who began to live and work in convents. So the sick then came to the convents for nursing care and also received spiritual care at the same time. During this period of time, the Catholic Church lost power and hospitals were removed from church possession. This resulted in some closing of hospitals, and some of the convents also closed or moved. And the hospitals that remained were no longer staffed by nuns, but rather women from a lower class who often had major problems such as alcoholism or were former prostitutes. The first required uniform came into existence and eventually changed to black dress, white apron, and white cap. And the control of hospitals became the responsibility of cities, which resulted in overcrowding and long work hours. And this is where the image of nursing started to change to a poor image, and also the image of hospitals. Nobody wanted to go to a hospital because of the overcrowding and the poor staffing. The beginnings of nursing reform evolved from efforts to reform prisons and hospitals. Florence Nightingale led the efforts to reform patient care and established nursing as a profession. She was the superintendent of nursing staff during the Korean War. And she was one of the first healthcare professionals to systematically collect data and improve care through the use of data. So she transformed the hospitals and reduced mortality rate. And if you see from your readings, the mortality rate went from 40% declined to 2% after the implementation of Nightingale's reforms. She elevated the profession, and nursing was considered an art. Her findings led to political attention that more funding was needed for the Army's hospitals, and she improved the cleanliness, hygiene, and nutrition. I put a link here. It says Florence video. You can click on that and it will bring you to a short, like 3-minute YouTube about Florence Nightingale. I also put a picture of her book, Notes on Hospitals. This is, I know a lot of nursing students get this upon graduation from nursing school. These are the essays that she has about the importance of hygiene, the need for fresh air and water, cleanliness, proper drainage, ample light, as well as ongoing consideration for the patient's feelings. So she was able to articulate this in the Nightingale Notes. So take a peek at it because it's, interesting to see, looking back history, what she had documented back then. During the Civil War, because of all the casualties and injuries that occurred, many homes were turned into makeshift hospitals to care for the wounded soldiers. Dorothy Dix founded the first American Army Nursing Corps, and she was given full power to organize human and material resources to care for the sick and the injured soldiers. Clara Barton founded the American Red Cross. She independently organized a large relief efforts to provide supplies to care for those injured on both sides of the war. And she persuaded the United States government to ratify the Geneva Treaty of the Red Cross, and this is credited with starting the American Red Cross. Pictured here is Mary Seacole. She worked with Florence Nightingale in caring for the injured soldiers during the Korean War. She also set up a hotel where she provided shelter, relaxation, and food. And when her guests became ill, she actually prescribed medicines. And after the war, she dedicated her life to elevating the nursing profession to become more respectable. Lillian Wald Mary Brewster opened Nurses Settlement House in New York City. They were termed public health nurses. They cared for many of the immigrants in New York City. They founded the Henry Street Settlement House, which was a community center for immigrants, for people living in the neighborhood, provided resources to the people in the area, such as vocational training. It had clubs, it had activities, provided public health nursing. It was a community meeting place. And they really were the first to describe what public health nursing was, that they were trained nurses who responded to the nursing needs outside of the hospital. Hospital training programs became the dominant form of nursing education in the early part of the 20th century. These were also known as the diploma programs. The associate degree programs came out of a 1951 doctoral defense, and in this defense, Mildred Montag suggested that education for technical nurses should occur at community college settings. So the associate degree program was given the same professional nursing licensure exam as graduates of the diploma and baccalaureate nursing programs. The baccalaureate programs in 1923, Yale University established a nursing program that had its own dean, and Case Western University and University of Chicago came about in the early 1920s also. The state registration of nursing licensure examination requirements, North Carolina led the efforts of this in 1903 by establishing guidelines for professional registration. Requirements included graduation from an established diploma nursing school. New Jersey and New York quickly followed after that. As the United States entered World War I, unmarried trained nurses entered the Army and the Navy Nurses Corps. The government launched a publicity campaign to recruit women into nursing, and the ads were glamorous. Nursing appeared in newspapers and magazines. However, when the nurses got onto the battlefields, it was a different story. They were seen injured. They were performing surgery to save lives. Nursing continued to have an image problem in the 1920s. Movies portrayed nursing in unrealistic and unflattering ways. Nursing shortage was the RNs continued to join the military. So what happened is the civilian nursing shortage resulted. So hospitals employed civilian workers who held certificates from the American Red Cross, and they also hired volunteers who have been helping nurses with non-professional duties. After World War II, the nursing shortage worsened even more as hospital beds became available. Many nurses left practice to get married for better paying jobs outside of the profession. On to the modern era, the 1960s to 1999. In 1965, the American Nurses Association comes out with a position paper on education stating that the entry level for nursing should be at the baccalaureate level and technical nursing should be at the associate degree level. We continue to see a growth of nursing education programs. We have the Nurse Training Act in 1964, which provided federal funding for diploma, associate degree, and baccalaureate nursing programs. The healthcare costs continue to rise, and we start seeing more healthcare disparities develop because of the rising cost of healthcare. We see mid-level providers because of the increased educational levels in nursing. At the master's level, we see nurse practitioners and also PAs delivering healthcare. Medicare, Medicaid continue to provide health care coverage to the elderly and to the poor. And we have managed care coming about to help control the cost of health care also. As we discussed in the previous slide, the rising healthcare cost, one way to reduce the cost during this period of time was the increased hiring of unlicensed assistive personnel. Even though the acuity level of patients were increasing in the hospitals, they had cut the reduction of the professional nursing staff and replaced it with unlicensed assistive personnel. Patient-focused care were really developed to increase patient satisfaction and also staff satisfaction. The clinical pathways were developed to improve quality of care, and this really standardized a plan of care for certain medical diagnoses. The National Institutes for Nursing Research, also known as NINR, was established within the NIH, or the National Institutes of Health. And this was really to increase the dissemination and the amount of nursing research that was being conducted. So it was to support future nursing science, and it was really to establish a scientific basis for nursing care of individuals across the lifespan. We see the role of the RN changing to becoming a more collaborative relationship. So there's more communication, teamwork, and collaboration with the healthcare team. And this was to improve patient outcomes, to improve safety, and also patient satisfaction. And the negative image of nursing is continued to be portrayed in the media. And your text does a nice job of giving some specific examples of that. The postmodern era is up to today. We continue to have scientific advances at rapid rate. The complexity of healthcare continues to rise along with the healthcare cost. We now have the mandatory use of electronic health records, and the population is aging. So people living beyond age 65 has increased 15.1% from 2000 to 2010. And within this population, 80% of the healthcare resources are used. The gap between the rich and the poor continue to widen. This results in increase in government funding for healthcare services. But the use of nurse practitioners has also demonstrated that these practitioners can deliver high quality healthcare economically without compromising quality care. In 2010, the Patient Protection and Affordable Care Act was passed, and this required all individuals to have health insurance. Continuing education and certification. There's more than 130 professional nursing organizations provide opportunities for further education in specialized practice fields such as critical care, maternal child health, public health, nursing education. And these specialty nursing organizations provide certification programs that can attest to knowledge and skill in the specialized area of practice. Along with specialty certification, nurses in a variety of practice settings participate in healthcare quality improvement programs. So the use of evidence-based standards for client nursing care when we are doing assessments and interventions reduces the client injuries and complication. And as we know, the image of nursing continues to evolve. Recognition of nursing as a respectable profession continues evolving today. The existence of the 3 levels of education that we discussed earlier in the presentation, the associate degree, the diploma, and the baccalaureate, is a key barrier to nursing attainment of the full professional status. Establishment of nursing's own body of knowledge. The new emphasis on the development and refinement of nursing theories allowed nursing to be established as a distinct discipline. And scientific advances are providing the opportunity for the profession to establish its own body of knowledge, as well as increase in the need for highly educated nurses. The continued showcasing of communication, collaboration, compassion, confidence, clinical, conjugative skills. All can shape the image of the nursing profession. And this concludes the presentation for Chapter 2. Thank you.